90 million people worldwide suffer from frozen shoulder syndrome. 40 million people in the United States alone suffer from insomnia. And if you add in all these other disorders that we're talking about, the Bell's palsy and all that, we're talking about millions and millions and millions of people that have these disorders. Nobody has any idea what's wrong with these people. And the word, we have to change that. We have no choice. That's what we're here to do.
To know that it's not a 3-year progress anymore and there's a possibility that you can have it right away is very promising for the future.
Anybody who's had a frozen shoulder knows that it lasts for anywhere between a year and 3 years, about 30 months average. You just got to kind of dissect it out. Where are the areas that aren't functioning good? The medical paradigm explains what you see in a frozen shoulder, but it doesn't have any correlation to what causes it. 75% of all the people that come to you with frozen shoulder that have been to a medical doctor have had an MRI or a CT scan of their shoulder, which is not the problem to begin with, and it'll show some problem with the shoulder. The shoulder is not the problem. The problem is the spinal accessory nerve. The scapula and the trapezius and muscle are run by the spinal accessory nerve, which is a cranial nerve. It's not a nerve that emanates in the spine per se. It emanates from the brain stem. Once I found this malfunction of the skull on the spine, I wrapped my mind around a way to correct it. Bring your hands up over your head and let your thumbs touch above, okay? Okay, that's as far as she's able to go.
As more and more people discover this and look at it for what it is, that would be the ultimate goal, is to have the students coming out armed with this and ready to go as soon as they hit their practices.
So what I'm doing is I'm gliding her skull, A to P, right? And as I glide her, I get her comfortable, I'm bringing her into forward flexion. I begin to laterally flex and rotate as I bring her into forward flexion. There's 3 things going on at once. Now I'm starting to feel for the springy end feel of that joint. I use my palpation to set my hands up and I try to get her relaxed. It's a very odd position to be in. Okay, and now we're just going to relax everything. Drop that head in my hands. There we go. Drop your head. Good. We're the only group that teaches this. We're the only group that has really been able to successfully reproduce a positive outcome time after time after time. And we're using the exact same analysis and almost the exact same type of treatment to dissolve most of these disorders. Palms are out here, and we're going to try to bring your hands above your head. That's pretty good. Okay. That's very good, very good.
It's really great. I mean, this is an answer to prayer. I was not paid, I was just asked to come and see if it would work for me, and it did.
I think that it's the most important thing that chiropractic that has come into chiropractic since I graduated 20 years ago.
If we can show an improvement that we're seeing clinically, it helps reduce healthcare costs, right? And that's a big button to push today, spending our healthcare resources more efficiently. Secondly, if you could take this patient who has had this problem that's really impacting their quality of life and get them back mainstream more quickly, it's good for the patient as well.
It seems like a magic trick or a miracle to a lot of doctors, whether it be medical or chiropractors that see this, but it's not. It's deeply in science. As soon as I started thinking, oh, this might have an effect on Bell's palsy, suddenly 4 or 5 Bell's palsy people just came out of the woodwork. And you don't know where they're going to come from, just like these frozen shoulders come out of the audience when we do these cases. I started to discover other cranial nerve problems that are associated with frozen shoulder and other disorders that were not associated with frozen shoulder that were also correctable with the same analysis and treatment.
Some patients who weren't able to see clearly and had some blurriness, by adjusting the area where there was a restriction in the occiput, their vision did improve pretty much immediately after.
These people regain their ability to move. Now their life has changed again. They're cooking again. They're fixing themselves up again. They feel good enough to exercise again. This is what makes it all worth it. And without that, it's, why do it?